Hi, this is Dr. G, your ortho guy, fellowship-trained orthopedic surgeon specializing in your hip and knee replacement. Today I'm going to talk about robotic surgery and Mako technology. Why do I use robots? First, it's customizable. Second, it has precise planning and execution. And third, it is reproducible. I have to discuss about total knee replacement. In previous episode, we discussed about how your knees can be bow-legged and knock knees. When you have a manual total knee replacement using one system fit all or using a jigs, you might not be able to capture some of the variations in patient's anatomy. With robots, I can capture all ranges because I'm using your knee ligaments to put the implants in a very customizable fashion, and patients are happy with that. In total hip replacement, I can also place the implant in a manner that is going to give you the best range of motion before you can have an impingement and before you can have a looseness in your hip. In partial knee replacement, very similar to a total knee replacement, in a way that I can put the implants in that is very customizable fashion for you to have a nice balance in all range of motion. Second, it has an excellent planning and execution system. When I have a robotic technology at disposal, I can have a 3D image of your anatomy. With this image, I can plan where the implant's gonna go. 95 to 99% of the times, I know what implant's gonna be that I need to put it in exactly. Of course, during the surgery, I adjust here and there depending on what your ligaments give to put the implants in a very precise manner. After doing this very innovative planning using a 3D imaging, we can execute in a very precise manner. Cuts are very precise. Reaming system for the total hip can be very precise. So that when the implants go in, there is a less human error attached to that. Third is a reproducible. Using a technology, there are checks and balances that will lead to reproducible results all the time. So those are the three reasons why I'm using a robotic technology. First, customizable. Two, precise planning and execution. And three is because it's a reproducible. I specialize in robotic technology in total hip, total knee, partial knee, as well as revision surgeries. There are many robots on the market right now. Why do I use Mako? It's because of its wide range of application, its long history, and it's dependable, and it's very accurate, and finally, patients love it. Mako is the first technology, or I should say, first robotic technology that was used in all the spectrums, meaning total hip replacement, total knee replacement, and partial knee replacement. So using the same robots, I can use all different types of joint replacements for hips and knees. And second point is that it has a very long history. In 2006, first Mako partial knee replacement done. In 2015, Stryker launched Mako total hip replacement. In 2017, Mako released first total knee replacement. And ever since then, people from around the world have been using a Mako technology in joint replacement. In fact, now there have been 1 million procedures done using Mako robotic-assisted technology across 42 countries. What does that mean? It brings it to our third point, that it is dependable. Because of its wide use and long history, there has been many data. And we have been going through many iterations or versions of different softwares to work on some of the errors that were present in the beginning. I'm sure you're familiar with using different apps and different technologies for the first time. When the technology comes in the market for the first time, there can be some errors, glitches, and kinks that need to be worked out. I'm not going to use a new modern technology for the first time for you. I want to use a technology that has been in the market for some time, that has been very dependable and has been worked on for many, many years before we can launch it or I can use it for my patient. And Mako has a great history of that. They're having many engineers working on all these kinks to make sure that there is a safety and dependability with this technology. A lot of my patients ask, it's like, what if this technology doesn't work? There are backups, checks and balances, registrations that are done in order to ensure safety and dependability with this technology. In the last 200 cases that I've done, there has been a zero occasion where I have to use a manual knee or total hip replacement because the technology didn't work. Fourth topic is accuracy. It is very accurate. Mako is the first robotic technology that uses what we call haptic boundary technology. As you can see on my left, in total knee replacement, the robotic arm comes in with a saw and cut it in a manner that is designed from previous planning. There is a boundary around it that is set, and the saw will not go past that. There is tactile, visual, and noise feedback that will give me so that I could not go further. The technology will not allow to go further than that. So not only the cut is very precisely done in a flat manner, it would not go further than what I plan to do so that there is less injury to soft tissue. Another example that you can see is that the reaming process is done in a manner that is very accurate as well too. It does not go further than what we intend to do. It can certainly do it, but it will give you a visual feedback that you do not want to go further. So it is very accurate. So the final point is that because I use this technology, patients have been loving it. Before I even started my practice, I knew which technology to use. I experienced that firsthand. I went to see my mentor's clinic and saw how patients did 10 days to 14 days after total knee replacement. I was very surprised at how all these patients were walking without a cane or walker, and they had excellent range of motion. And fortunately, in the last 2 years, I've been seeing great results. That's why I'm using this technology, and that's why I'm using a Mako. Thank you for watching for my video again today. Check out other videos on YouTube, and if you have any questions and concerns, please leave comments. Thank you.